Hey everyone, welcome back to my channel. I'm Dr. Mike, and I'm glad you're here because today we're diving into a topic that's super important for your health and well-being: sexually transmitted infections, or STIs. We're going to break down the different ways STIs can spread, and most importantly, how you can protect yourself. Whether you're sexually active, thinking about it, or just want to be informed, this video is for you. Let's get started. Alright, let's talk about the most common way STIs spread: unprotected sex. Now, when I say unprotected, I mean any sexual activity, vaginal, anal, or oral, without a barrier method like a condom. And here's the thing, even if there's no ejaculation, transmission can still happen. That's because STIs are spread through contact with infected fluids like semen, vaginal fluids, or even just tiny amounts of blood that you might not even see. These fluids carry the viruses or bacteria that cause STIs, and they can enter your body through small cuts or tears in the skin or mucous membranes of the genitals, mouth, or rectum. So bottom line, always use protection. Now, here's something many people don't realize. Some STIs can actually spread through skin-to-skin contact even without any fluids being exchanged. We're talking about STIs like herpes, which causes those painful sores, and HPV, which can lead to genital warts, and even certain cancers. These viruses live on the skin and can be passed from one person to another through direct contact, even if a condom is used. Why? Because condoms don't always cover every infected area. So even if you're being careful with fluids, it's crucial to be aware of any sores or unusual bumps on your partner's skin, and to be open with your partner about any concerns you have. Let's talk about something really serious: sharing needles. This is a major route of transmission for blood-borne STIs like HIV and hepatitis B and C. These viruses live in the bloodstream, so sharing needles, even just once, can have devastating consequences. Whether it's for drug use, getting a tattoo, or even something as simple as a piercing, always make absolutely sure that sterile needles are being used. Don't be afraid to ask questions and advocate for your health. Remember, using a new sterile needle every single time is the only way to eliminate the risk. Chapter 4. Now, let's talk about a situation that's close to my heart: the health of mothers and their babies. Sadly, some STIs can be passed from an infected mother to her child during pregnancy, childbirth, or even through breastfeeding. This is called vertical transmission, and it can have serious consequences for the baby's health. STIs like HIV, syphilis, and herpes can all be transmitted this way. That's why prenatal care is so incredibly important. Early testing and treatment can significantly reduce the risk of transmission and protect the health of both mom and baby. Chapter 5. While it's much less common these days, it's important to be aware that STIs can be transmitted through blood transfusions. This is more of a concern in countries with less stringent blood screening processes. In developed countries like the United States, the blood supply is rigorously tested for HIV, hepatitis B and C, and other infections, making the risk of transmission extremely low. However, it's always a good idea to be informed and ask your doctor about any concerns you might have, especially if you're traveling to areas with different healthcare standards. Chapter 6. Finally, let's talk about the importance of being aware of the signs of STIs and avoiding contact with any sores or body fluids that look suspicious. Remember, some STIs can cause sores or blisters around the genitals, mouth, or rectum. If you notice anything unusual, it's crucial to avoid any sexual contact and see a healthcare professional right away. Early detection and treatment are key to managing STIs and preventing complications. And remember, even if you don't see any visible signs, it's always best to practice safe sex and get tested regularly, especially if you have multiple partners. Outro. So there you have it, the ins and outs of how STIs spread, and most importantly, how to protect yourself. Remember, knowledge is power, and the more you know about STIs, the better equipped you'll be to make healthy choices. To recap: practice safe sex, get tested regularly, communicate openly with your partners, get vaccinated against HPV and hepatitis B, and never hesitate to seek care if you have any concerns. STIs are common, but they're also preventable and treatable. Let's work together to break down the stigma and create a world where everyone feels empowered to prioritize their sexual health. If you found this video helpful, give it a thumbs up. Subscribe to my channel for more health tips and share it with your friends and family. And as always, drop any questions or comments you have below. I'm here to support you. Thanks for watching and stay healthy.